Hello everyone, this is Dr. Tushar Mehta. I'm an orthopedic surgeon and a faculty of orthopedics. I hope you enjoyed that video of 10 important one-liner questions of orthopedics for FMGE entrance exam this year. Now it is the time to have 10 important image-based questions for orthopedics for your FMGE entrance exam. I'm sure you can see this first image. So this shows a posterior displacement of the distal fragment of the distal end of the radius with the dinner fork deformity, and I hope you got the answer right, Colles fracture. The second image that you can see right now is basically showing you avascular necrosis of the head of the femur crescent sign. The third image that you're able to see right now shows sun ray or sunburst appearance, which is a periosteal reaction along with this Coatman's triangle, that is the diagnosis osteosarcoma. The fourth image that you can see right now is the clinical photograph of a child who has genu varum. But that's not the question. The question is that most common cause of this genu varum over bow legs is rickets. The next question that you can see, the next image that you can see, the fifth image that you can see here is image of a fracture. First of all, you tell me the fracture. It is supracornular fracture humerus, but that's not the question. The question is that this supracornular fracture humerus is coming with this complication. I hope you can see the complication. Tell me the name of this complication. Yes, Bookman's ischemic contracture. The sixth image which you are seeing here is an MRI. Now in this MRI, what you can see is a disc prolapse with some nerve root compression, and that is a problem for back pain with radiculopathy. But again, that's not the question. What is the diagnosis? Lumbar disc herniation. Look at the seventh image. It's an X-ray where you can see a lytic lesion in the epiphysis of this bone. So this lytic lesion in the epiphysis of a long bone, and this patient is an adult, skeletally mature. Come on, tell me the answer. GCT. Look at this eighth image. This is the clinical image of a clinical condition, and I'm sure you have appreciated by now that this is for drop. But that's not the question. They will give you this image and they'll ask you the reason behind it, the nerve injury behind it, and your answer will be common peroneal nerve. This ninth image, what you can see here is an X-ray where you can see that there is some scalloping of the vertebral body and there is some paravertebral soft tissue shadow and everything. What is the diagnosis? A very common condition in idiopathic spine. The last image where you can see this image, and they've shown a fracture here, and they're asking you that which is nerve at risk of this problem of this fracture, and this is a surgical neck of humerus, and the nerve which is at risk is circumflex branch of axillary nerve. You cannot afford to miss these 10 important images and the questions related to them. Once the exam will be over, you'll be able to come back and tell me that yes, most of them came in your exam. I wish you all the best.